Hello, my name is Carlton Nicholson. I'm an RN, and I would like to discuss with you today the topic of improving antipsychotic adherence with schizophrenia patients. So the PICO question that I focused on is, in patients diagnosed with schizophrenia, how do support service interventions focus on medication adherence compared to no support service intervention focused on medication adherence affect improvement in medication adherence within 4 months? So healthcare problems selected for review is that poor adherence to antipsychotic medication is prevalent with patients diagnosed with schizophrenia. Also, poor adherence often results in a myriad of unfortunate situations with these patients. It also not only affects the patient, but it also affects family members, friends, and other members of the support system for this patient. So evidence that supports the importance of the problem is that patients with schizophrenia, their families, and their communities bear the burden of significant social and economic impact of poor treatment adherence. Also, it affects about 1% of the world's population, which turns out to be about 2.4 million Americans, according to the NIH. So studies reviewed investigating these interventions that may promote medication adherence is telephone intervention, motivational interviewing, and adherence therapy. So just to give you a brief synopsis on these 3 studies that I had chosen, all 3 were randomized controlled trials that focus on the intervention group as well as a control group. Now, there were no third group studied in any of these 3 studies. Now, all participants were diagnosed with schizophrenia. They were all aged 18 and above, all adult, and they were all outpatients. So study 1, the telephone intervention, had a sample size of 865 with an attrition rate of 3 participants. The assessment tool that was used was the DIA, which is the Drug Attitude Inventory. And the result from this study was that there was 8.5% increase in medication adherence as opposed to 1.1% increase in medication adherence with the control group or the treatment as usual group. Sample 2 had 114 participants. What stood out was that there was excellent inter-rater reliability, which was 95 to 100% in agreement. The assessment tool used in this study was the ARS, which is the Adherence Rating Scale. Now, this study resulted in significant improvement with the adherent therapy group, as opposed to no significant improvement with the treatment as usual group or the control group. Now, the third study only had 26 participants, and the assessment tool that was used in this study was the PEDIT, or the Personal Evaluation of Transition and Treatments tool. Now, there was no statistical difference in medication adherence between the 2 groups as far as the treatment group and the treatment as usual group goes. However, 66% of the participants stated that they understood more about their meds, so it was not a total loss as far as effectiveness goes. So the participants actually learned something. They actually liked the study, actually. So it turned out to be a good study after all. Synthesizing the body of literature that could be used to support improved nursing practices, prompting adherence via telephone intervention has proved to be effective. Also, motivational interviewing was effective as well. It was a helpful tool to increase antipsychotic adherence. Adherence therapy, however, wasn't clinically significant or statistically significant, but there was some positives that came out of that study. So in the environment that I would choose with this type of practice is the outpatient mental health clinic. It serves as the perfect environment for improving medication adherence with the patients. identifying the proposed change is that I would choose is the telephone intervention, utilization of the clinical nurse via telephone call to enhance telephone compliance, medication compliance. I'm sorry, telenursing intervention provides a trifold benefit, which is saving taxpayers money, serves as an extra entity to the patient support system, and it also keeps the patient on track with meds and consequently with their life. I thank you for your time. I hope this served as an educational tool and increase your knowledge on medication adherence with schizophrenia patients.